10 common ovarian cancer signs that you should never ignore. Ovarian cancer is often called the silent killer for a reason. Its symptoms can be so subtle and easily mistaken for minor issues that identifying it early becomes a challenge. However, knowing what to look for can make a world of difference. This video explores 10 key warning signs of ovarian cancer that you should never ignore. By recognizing these symptoms early, you can take proactive steps toward better health, potentially saving lives, yours or someone you love. Let's dive in and empower ourselves with the knowledge to spot the early signs of this dangerous disease. Before we get into the details, let's briefly understand ovarian cancer. It starts in the ovaries, which are part of the female reproductive system. Ovarian cancer can grow quietly and is often diagnosed at later stages when treatment options become limited. It's a serious illness that affects thousands of women every year, and yet, early detection can significantly improve outcomes. The problem? Ovarian cancer symptoms are often vague and easy to dismiss. Many women mistake them for everyday issues like bloating, digestive problems, or aging. This makes it critical to identify any unusual or persistent changes in your body. Now, let's look at the 10 signs you need to know about. Have you noticed your abdomen feeling uncharacteristically swollen or bloated? Occasional bloating happens to everyone, but persistent or increasingly noticeable bloating could be a warning sign of ovarian cancer. This kind of bloating doesn't go away with dietary changes or over-the-counter remedies. It's uncomfortable and may make your stomach appear distended. Don't brush it off. Track when it happens, how long it lasts, and how bothersome it feels. Pain in your abdomen or pelvis for no clear reason could be another red flag. While menstrual cramps happen to many women, pain caused by ovarian cancer is constant or recurring, even outside of your period. The pain might feel like a dull ache or a more piercing discomfort. Whether it's mild or severe, if pelvic pain persists and interrupts your daily life, it's time to speak with your doctor. Another symptom to pay attention to is a sudden decrease in appetite. Have you found yourself eating less because you feel full after just a few bites? This is especially concerning if it happens often and doesn't make sense based on what you are eating. Ovarian cancer can cause digestive changes, including pressure on the stomach or intestines, which leads to a sensation of fullness or appetite changes. If this persists, consider reaching out to your healthcare provider. Have you noticed a significant change in your body weight for no apparent reason? Unexplained weight loss can be concerning, but sudden weight gain, often caused by fluid buildup in the abdomen, called ascites, can also be an indicator of ovarian cancer. These weight fluctuations might seem strange and unrelated, but when accompanied by other symptoms on this list, they can be warning signs worth investigating. Frequent trips to the bathroom, waking up at night to urinate, or a sudden urgency to go even if your bladder isn't full. These may feel like inconveniences rather than health issues. But when ovarian cancer pushes against the bladder, these can become noticeable and consistent symptoms. If you find yourself rushing to the bathroom more often than usual, especially if this is out of the ordinary for you, this could be your body signaling a problem. Another sign to note is a noticeable change in bowel habits. Ovarian cancer can cause symptoms like constipation or diarrhea due to pressure on the intestines. Experiencing occasional digestive changes isn't uncommon, but if these changes become frequent or severe, they require medical attention to determine the underlying cause. Fatigue can feel like an ordinary part of life in today's fast-paced world, but ongoing or severe fatigue that doesn't improve with rest could be a symptom of ovarian cancer. This kind of exhaustion isn't the same as being tired after a long day. It feels debilitating and can interfere with your daily activities. It's essential to consider fatigue in the broader context of other symptoms to understand whether it might point to a larger issue. Lower back pain, often dismissed as a muscle strain or tension, can sometimes indicate ovarian cancer, especially when combined with other symptoms. This type of back pain doesn't necessarily improve with rest or physical therapy, and in some cases, it may worsen over time. Persistent, unexplained back pain warrants further investigation. For women of reproductive age, changes in the regularity, length, or flow of menstrual cycles can sometimes signal ovarian issues. While irregular cycles can also be caused by stress, hormonal changes, or other conditions, they shouldn't be ignored, especially if accompanied by other symptoms like pelvic pain or bloating. Changes in menstrual cycles in postmenopausal women are particularly concerning and require immediate medical attention. Discomfort or pain during intercourse can also be a sign of ovarian cancer. Many women don't talk about this symptom because of embarrassment or the belief that it's unrelated to health, but it can indicate something more serious. This symptom can be caused by ovarian masses or inflammation in the pelvic region, so it's crucial to bring it up with your doctor. Individually, these signs might not seem alarming. We all experience bloating, fatigue, or minor changes in our appetite or routines from time to time. However, when these symptoms persist or appear together, they may point toward ovarian cancer. Keeping track of symptoms is essential. Journaling how often these signs occur, their intensity, and any changes over time can help you and your doctor recognize patterns and make informed decisions. It's worth noting that each of these symptoms can be caused by a variety of other conditions, like irritable bowel syndrome, hormonal changes, or urinary tract infections. While these explanations might be more common, ignoring symptoms or trying to self-diagnose is never the best course of action. Let your doctor rule out anything serious. Catching ovarian cancer early can make a life-saving difference. When detected in its early stages, the survival rate is significantly higher. Unfortunately, most ovarian cancer diagnoses happen once the disease has already progressed. That's why it's so important to pay attention to your body and act quickly if you notice anything unusual or persistent. Unfortunately, there is no routine screening for ovarian cancer, unlike mammograms for breast cancer or pap smears for cervical cancer. Tests like pelvic exams, ultrasounds, and CA-125 blood tests are used when symptoms arise, but they're not foolproof. This makes awareness of the warning signs all the more critical. Taking charge of your health starts with attention and action. If you notice any of the symptoms discussed in this video and they persist for more than 2 weeks, don't wait. Book an appointment with your healthcare provider and share your concerns. It can also help to track your symptoms in a journal. Be specific. For example, note when the bloating began, how long it lasted, how severe it felt, and whether other symptoms appeared at the same time. It's important to advocate for your health. If you feel dismissed or unsatisfied with a medical opinion, don't hesitate to seek a second opinion. You know your body better than anyone. Trust your instincts and speak up when something feels wrong. Don't keep this information to yourself. Share it with your loved ones, your sisters, mothers, daughters, friends. Awareness spreads faster when we work together to educate others. It's natural to worry about overreacting or feeling embarrassed when discussing certain symptoms. But remember, taking your health seriously is never an overreaction. A simple test or consultation can provide peace of mind or lead to valuable early detection. Ovarian cancer doesn't have to be silent if you know how to listen to your body. Let's recap the 10 symptoms to watch for. Persistent abdominal bloating, abdominal or pelvic pain, feeling full quickly, unexplained weight loss or gain, urinary urgency or frequency, changes in bowel habits, fatigue, back pain, irregular menstrual cycles, and pain during intercourse. These signs may seem small, but they carry a powerful message. Take care of your health, listen to your instincts, and never ignore symptoms that persist or feel unusual. Early detection isn't just medical, it's empowering. Thank you for watching. Remember, your health is your wealth. Share this video with the women in your life. Who knows? You might just save someone's life today.